Okay, I think he wanted to talk about this because what happens if you're going into shock, your kidney shut down. So let me talk a little bit about acute versus chronic kidney failure. So you have acute kidney failure. A couple points that you guys got to remember. You got to know the words pre-renal issues, intra-renal issues, and post-renal issues. Imagine this is the aorta. Let's see if I can do this. This is the aorta. This is the renal artery. It's going here. And your kidneys are right here. When I say pre and intra and post-renal, these are describing the location of the problem that caused acute kidney failure or acute kidney injury. If you have a pre-renal issue, that means that the issue occurred before the structures before the actual kidney. So for instance, if you're going into hypovolemic shock, well, the issue is not in the kidneys. The issue is actually that the blood's not sufficient to perfuse the organs. That's pre-renal. It's a acute kidney injury. The cause is a pre-renal issue. If the issue is intra-renal issues, that means that it's within the actual kidney. That could be the patient has a kidney stone that destroyed the vascularization of the kidney. That would be an intrarenal issue that's causing the acute kidney injury. And you have post-renal issues. Now, post would be the ureter that's taking the urine from the kidney to the bladder, right? So if you have, let's say, a stone here and the urine backs up and then it causes hydronephrosis, fluid in the kidney, and it ruptures the nephrons, well, you go into acute kidney injury, but the issue is a post-renal issue because the anatomical location that created the problem, that would be beyond the kidney or after the kidney. So just remember these terminologies because they'll give you like a particular scenario of a complication and they'll tell you, is that acute? I'm sorry, is that pre, intra, or post-renal issues? That whole issue of metformin and contrast medium, you know how we can't have them in the blood at the same time? You have to hold metformin for 24 to 48 hours before and after the contrast medium. If we give both of those drugs at the same time, the contrast medium, the metformin, when both of those chemicals go inside the kidney, they cause the kidneys to shut down. Now, what would that be? Pre, intra, or post-renal issues? I think it would actually be intra-renal issue because the issue happened when both of those chemicals enter the kidneys and then the kidneys shut down. So I want you guys to learn them in that context. Whoops. Okay. Now that's just the pre, intra, and post. Acute kidney injury has 3 phases. It has your It has your first stage, which we call the oliguric phase. And this is when the patient's urine output decreases, right? Significantly. It could be less than 400 every 24 hours. But the oliguric phase is when your kidneys shut down. That lasts several weeks. And that's when you're going to have like all your lab values that are messed up. Your BUN will be high. Your creatinine will be high. Your glomerular filtration rate will be low, of course, usually less than 40 mLs per minute. And you're going to have all the issues that you see accompanied by kidney issues, meaning your electrolytes are all going to be elevated except for calcium. Calcium goes down and you'll develop osteoporosis. During the oliguric phase, you may also have things like anemia because the kidneys release erythropoietin, which stimulates bone marrow to produce red blood cells. And if you have acute kidney injury, you're not going to be producing that hormone, so you'll have anemia. My point is, all of those complications are here during the oliguric phase. The patient will need dialysis, all that stuff. But the cool thing about the acute kidney injury is that you transition into the diuretic phase, meaning you regain some degree of kidney function. And that's called the diuretic phase. During the diuretic phase, the kidneys slowly are regaining their function, but they cannot concentrate the urine yet. So your BUN, your creatinine, your electrolytes may still be out of whack, but you'll see a lot of pee coming out, but it's usually clear because your kidney still cannot remove the toxins, the substances that it wants to get rid of. So it's slowly regaining its function. And that can lead to, that could last several weeks as well, a couple of months. During the diuretic phase, you're really careful with hypovolemia. The patient might lose too many fluids, so you might have to give them fluids again because they're only getting rid of the easiest thing, which is fluids, not all the waste and the ions. And then lastly, they'll transition into the rehab phase. The rehab phase is determined by when these values start going back to normal. And that can take up to a year for the kidneys to regain their full function back. And that is acute kidney injury, guys. I hope that kind of made sense. And that's what this thing talks about right here. Acute kidney injury versus chronic, onset over days or weeks, right here, onset over weeks to months, and yada, yada. You guys could read this, but essentially what I explained next door in the slide was everything. I do want to talk about specific gravity though, both of these. Specific gravity or gravel, it's talking about the amount of waste that's inside a fluid solution. And so gravity, think of gravel. And so when you have, it depends on what fluid you're assessing. If you're assessing your urine, if it has less water and more solids, then the gravity is high. If you have someone who has diluted urine where it's very clear, then the specific gravity, the gravel is low. I hope that makes sense.